Elizabeth Smith McCrossan just wants to make a name for herself, and she's dragging everybody through the muck in Pugwash and raising consternation, raising the ire of people, and blaming your boss, Tim Houston, and you and your colleagues for complicity in this, and that you're just keeping the whole thing hush-hush.
Yeah, look, Bill, thank you for the question. And you and I have talked a little bit about this offline last week when we couldn't have our interview. What I told you last week is this was brought to me from some doctors that were in agreement, saw some issues, but this has been a conversation that I've been having with the healthcare providers for over a month now, I think it was, and having conversations with the minister and the department offline and things. But yeah, you're right. There was a negotiation of a new pay scale for rural physicians and physicians that are providing CEC treatment, emergency room treatment, and there was a pay scale put out with options for physicians to make decisions in there. I don't have the details of that because as a minister and even as an MLA, we're not allowed to infuse ourselves with the HR negotiations, if you will, the human resources negotiations. That would be the same with myself in the Department of Natural Resources. I don't infuse myself. It's actually against the process for the minister to be infused. That's why we have deputy ministers at it. But what I can also say, Bill, is there was a pay scale that were options for physicians to pick through. I've been talking and actually had a 2-hour meeting with the Department of Health yesterday. I'm going back for further updates to answer some questions. But this is a fluid situation that I understand that has been rolled out, started to roll out in other facilities in 2023. But there's options there for actually physicians to make more than what they're making now, because it's a pathway. What was explained to me, this is a pathway to also recruit to rural communities, and the department has told me that they've seen some success with this already. And they're going to carry on. They also informed me this week that Nova Scotia Health was actually at the facility this week to talk with staff there and some of the providers and managers and see some of the concerns that are popping up. I know there's conversation that the ER is completely closed. Nova Scotia Health has informed me that there's coverage at that hospital. There's doctors that are stepping up and filling those voids. It's like any other negotiation, though, Bill. I want to be very clear. It's like any other negotiation. There are people that appreciate the new contract deal. There are people that don't appreciate the new contract deal. And what I'm doing is infusing myself to try and have the meetings to get the right people in front of the people that have the questions, so they can negotiate and have that conversation about what the issues are. Because you look at our area specifically, Bill. The needs in Pugwash are different than what the needs are in Parisbro versus what the needs would be in the Spring Hill facility. And what I did appreciate yesterday is Nova Scotia Health in their conversations recognized that for me, that yes, very much a rural community, very much embedded in Cumberland County, all 3 facilities, but you can't treat all of them as if they're providing the same services, because quite frankly, they're different facilities. So that's why I asked the department to get together with Nova Scotia Health and come and have a conversation with the people that have the questions, and sit down and hash these things out. I was quite pleased with the discussion that started yesterday again, and looking forward to the meeting again this afternoon with the minister.
Well, you say you want them to get together and have conversations with the community, and I would argue we did that.
Well, no, it's not with the community at this stage. This is about a pay scale with specific people. If you were having a discussion about the pay scale with forestry workers, if you will, you wouldn't be having that discussion with the community. It would have to be with the people that are impacted, Bill. And these are the people that I'm hearing. I've heard from doctors that are very supportive of this and have said that with this scheme, it's actually going to hold me within the facility that I'm working at even longer than what I plan to. But I've heard from some doctors that have some concern. And with those concerns has to come a conversation with the right people in the room to have these conversations to alleviate those concerns.
Understood.
And so that's what I'm talking about the conversations.
Okay.
These are with the people that are impacting and covering and filling in our services.
Now, at the same time, when we look back a number of years, Nova Scotia Health didn't exist. It was the Department of Health, and they would negotiate with Doctors Nova Scotia on a fee-for-service menu, if you will. And that's how doctors got paid. You take out the tonsils, you get this much money. You check the tonsils, you get a little less. And that's the doctors did that. They provide a service and get paid. Now, over the years, doctors wanted to move towards salaries, and they've come up with all kinds of systems and so on where the negotiations get a lot more difficult as you try to marry the two, the fee-for-service along with salaries and so on. But the question of this one, the question of service in the ER, has been a bone of contention for people in the Pugwash Hospital catchment area for a long time, and in particular prior to the opening of the new hospital. And you'll recall that I really put my whole life and reputation on the line taking on Nova Scotia Health when they were secretly and quietly trying to do away with ER in favor of urgent care. And I was able to, twist them into a corner, perhaps, because unfortunately I've been persona non grata ever since. They squeezed me off the doctor search committee. They squeezed me out of my representation in that committee. They've squeezed me out of everything, which is fine. I don't need to be there. I don't like to go where I'm not welcome in the first place. But I was able to get a public meeting, and you'll recall that, in which they stood and said very clearly they had no intention of doing away with the ER in favor of urgent care. And the people were greatly relieved. Everybody went home and said, what a great meeting, and it was. But lo and behold, now we're back in these kinds of discussions, and you're right. They're looking at a package of services that would be provided to a physician willing to work in the context of the Pugwash Hospital. And if you look closely at the detail, the doctor will get paid for providing, the coabulative services. The doctor will get paid for all kinds of things that he or she does. And included in that is if the doctor participates in the urgent care service, the doctor will add another a level of income, and the total package gets better, not less, gets better. But the point that I want to make is that once again, we're seeing that nowhere in those discussions are we talking about emergency medical services. We're talking about urgent care services. And this agency that promised they were not going to switch to urgent care has just found another way to get what they want. And I have been arguing against this group of people for their absolute arrogance, their absolute, this is my department and I'll do it my way. And as a consequence, here we are once again seeing them trying to give us what they want, but disguised once again. So the issue is not as described by Elizabeth Smith McCrossan. The fact of the matter is that Nova Scotia Health is throwing its collective weight around once again.
So what I can tell you, Bill, you and I both had these arguments with Nova Scotia Health previous to me being in the government side, but also when I was in the government side. You recall the conversations I had to have to get the services put back into Parisbro. You recall when we had the issues at the Spring Hill Hospital, and now these conversations in Pugwash. But what I can tell you yesterday with the Department of Health, the conversation was about how we are going to recruit doctors to come in and cover an ER department, how we are going to get doctors to come in and help take the patient load off the doctor wait list. It was how we can make sure that we have physicians to cover the long-term care facilities that we have in our areas. So there's an array of things that the physician themselves can select from. Here's the services that I, with my family fit, can provide services to. So these are ongoing conversations. But even when you put the conversation or document in front of any employer, whether it's a doctor or an electrician or a forestry worker, a document says one thing, but a conversation goes a lot further. And I certainly appreciate the physicians that have reached out to talk to me directly, whether they like what's going on or have some concerns with the new negotiated pay scale. They have been very, very vocal that they appreciate that what is being tried to take place from the government. They were very clear that they see a government that is trying to invest in healthcare, and they also did recognize the fact that this is a tool that the Nova Scotia Department of Health and Nova Scotia Health is trying to utilize as a recruitment tool as well. that if somebody was to come to a rural community, here's the pay scale that you can get, but here's other options that you can also provide services that we need in our rural communities, and here's the top ups that you can receive as well. So like I said, I had one physician that called me from another facility outside of our area in Cumberland County, but just reached out knowing who I was, and had a conversation that he actually took the opportunity to select different options that he currently wasn't going to be working with. Had a little skepticism of what it was going to look like in a year's time, but he was willing to help out because he knew that there was patients on that doctor wait list in his area that needed to be attached to a physician, not necessarily just to be able to go to an ER and fill prescriptions. So there's a huge step here too, that we still have a huge number of Nova Scotians on a doctor wait list, and this is part of the initiative as well, is to take care of the patients.
Why do we have a Nova Scotia Department of Health and a Nova Scotia Health?
Yeah, that's a question that I still ask, and if you recall, when we still had the local authorities, they were a different bunch of authorities in different ways. I forget what government was that amalgamated all this together. When we did get in, we did take part of the Nova Scotia Health Authority apart and put those sectors back into some local decision making, and also within the Department of Health and Wellness that oversees some other things. But that's something that I talk to the Premier regularly about, and the Minister of Health. As to what's our focus on the authority and where it's going with Nova Scotia Health. And the ministers, I guess, sort of summed it up. We're trying to concentrate on patient care right now, and ensure that we have the healthcare providers and the reimbursements that are needed for those providers. And that's why we're seeing some new pay scales for recruitment and retention. There are issues out there. There's no doubt about that, Bill, but that's why I wanted to be at the table with the minister, with the department that's available, that I can have these conversations with and advocate for the people that have reached out to me in healthcare in our area to get them to come and have those fulsome conversations at the table, and maybe not out in the public where you don't get the decisions made. They're actually made at the table. So we need to have the right people to come into our facilities and have those discussions with the people that are being impacted.
Tory, I'm going to ask the question again because you didn't answer it. I'm sorry.
I did say I don't know.
No, you know full well that my history involves a number of years where I worked with the Doctors Nova Scotia. So understanding the dealings with the Nova Scotia Health, there was no Nova Scotia Health at the time. It was just strictly the Nova Scotia Department of Health. Negotiated fees with doctors, negotiated everything with hospitals, negotiated it all, ran the whole department. And then along came Nova Scotia Health, its own little fiefdom. And when you came into power, when I say you, when your government came into power, one of the first jobs you did was to fire the board of directors of Nova Scotia Health. And we all thought the next shoe will be to dismantle Nova Scotia Health and return control of the whole thing to the Department of Health under a Deputy Minister of Health, and we could reestablish some local content if we felt it necessary. But we've witnessed throughout all of this, Nova Scotia Health continues to do whatever it damn well pleases, and when they get caught, like they did with their intended lie to do away with emergency care in Pugwash going back a couple of years ago. And they were forced to stand up in front of the public, not a secret little group of people that they wanted to have. And they backed down. And they said, no, we're not going to dismantle emergency service. We're not bringing in urgent care. The fact of the matter is this whole kerfuffle centers on the pay scales are enhanced for doctors providing urgent care and not enhanced at all for doctors that want to provide emergency care. Fire Nova Scotia Health and we can get back to doing something right for the people.
Yeah, I hear you, Bill. You and I shared this conversation many times, but I do have to correct you. This new pay scale is not just urgent care. It is also including emergency care in our facilities, which includes Pugwash. That emergency care conversation is taking place. It's one of the options that the physicians can take is emergency care.
All right.
To the point that there are physicians that have taken some of the coverages for April. There have been doctors that reached out and said, I will take that shift in Pugwash. So I mean, there are doctors stepping up, and like I said a few minutes ago, that there are still issues that have to have the conversation, and that's where I'm focusing my energy on right now, to get the right people at the table to alleviate some of the myths, some of the stories, and get things closed off once and for all, so our services will continue and be enhanced when we can recruit more with this new pay scale.
I agree that the negotiations are underway and that negotiations need to be underway. My argument is the negotiations are underway with the wrong people. And these people have been running roughshod over healthcare in Nova Scotia since they came into existence, since they took away any input from the local community way back when. I think it was Stephen McNeil's government. And we really thought that you were going to fix that. They're part of the problem. They're an arrogant bunch of people who do what they want, when they want, how they want, and they'll do it no matter what. And the time has come to realize they don't own Nova Scotia healthcare. They don't, and they need to go.
The other thing that just before we run out of time, Bill, the other thing to point out too is I know your beef with Nova Scotia Health, and I share some of those beefs as well. You know that, and. But they're not the only ones at this negotiation table. Doctors Nova Scotia are also at this table.
Oh, of course, they have to negotiate with somebody, and that's the other side. Yes.
But I mean, even Doctors Nova Scotia have come out and made a statement that some of the stories that are going on about what's going on in rural community hospitals, that's not necessarily factual. We heard that from Doctors Nova Scotia, but like my focus isn't to stir the pot, if you will. I want to get the right people at the table and have these conversations. I was very optimistic yesterday, and hopefully optimistic again today that those people be coming to a hospital near us very shortly and alleviating some of the pressure and sharing that information. I know I've talked to a few doctors that cover Pugwash, and like I said, some are happy, some are not happy, but we need to make sure that it's an environment that is welcoming to our patients, and the patients need to know that as a government, we're respecting our healthcare providers, but there are services that are being provided in our facilities, and we need to get over this hurdle so we can get back to the recruitment and retention into our rural communities.
I appreciate that, and I thank you for putting up with my wrath today. And we opened up the conversation by saying I'm not 100%, I'm not 100% well. Imagine if I was up to normal. Oh, I almost got a cough going there, almost. The Premier will be on with me next Monday. That's his regular time to be here, and maybe I can calm down enough to have more of a conversation with him, because he's been dragged into this as well by Smith McCrossan. She keeps making everything that she thinks is wrong all about him. And it's a sad fact that she's only trying to butter her own bread and muddy the waters, and she's using people in the process, and that really upsets me. So when you get people who think that they're bigger than the rules and bigger than the law and bigger than everything else, I guess I feel I've got a responsibility to do a little yelling and screaming. So today you were at the brunt of that, and maybe I should apologize to you, but I'll hold judgment till another day. How's that?
No, Bill, no apology needed in this case, Bill. You and I have conversations. You've been more than respectful with me, and no apology needed towards me. I mean, this is a serious conversation, and my approach is to get the right people at the table and have those conversations with the right people that can make decisions. And that's why I'm carrying on this afternoon to carry back over to the minister and have another conversation with her and her department, and try to get the right people into Cumberland County to have those conversations with the service providers.
Well, again, appreciate the fact that conversation is taking place. I just think we're talking about the wrong people at the helm.